Welcome to the self-evaluation episode of the ASCO University Weekly Podcast. My name is Karen Wingfield, and I am Associate Director for Cancer Health Equity and Director of Hematologic Radiation Oncology at the Comprehensive Cancer Center at Wake Forest Baptist Health in Winston-Salem, North Carolina. Today we feature a self-evaluation question on the treatment of multiple myeloma and other plasma cell dyscrasias, and we begin by reading the question stem. A 60-year-old woman is referred to you with a history of recent onset weakness, weight loss, headache, pancytopenia, and mild renal impairment. Physical examination reveals mild hepatomegaly and moderate splenomegaly. Results from complete blood count are hematocrit of 29%, hemoglobin 9.1 grams per deciliter, white blood cell count 2.1, and platelet count of 101. Peripheral blood smears show that 36% of the nucleated cells are plasma cells. The plasma cells are CD56 negative and strongly CD27 positive, and cytogenetic studies reveal translocation 414 in all 20 metaphases examined. Skeletal radiographic survey is normal. Which of the following treatments would be best for this patient? Choices: A. Melphalan and prednisone, B. VAD or vincristine, doxorubicin, and dexamethasone, C. Ibrutinib, D. A bortezomib-containing regimen followed by autologous stem cell transplantation, or E. Rituximab and thalidomide. The correct answer to this question is D. A bortezomib-containing regimen followed by autologous stem cell transplantation. The absence of CD56 on malignant plasma cells is a hallmark of plasma cell leukemia. Bortezomib is especially helpful in the treatment of primary plasma cell leukemia because these tumors are CD27 positive, which activates NF-kappa B. Bortezomib has significant activity against NF-kappa B. Therefore, treatment with bortezomib regimen followed by autologous stem cell transplantation has yielded the best overall survival in primary plasma cell leukemia. Briefly, the other choices presented in this question do not represent the most appropriate therapy for the following reasons. Ibrutinib and rituximab are not used in plasma cell disorders, ruling out options C and E respectively. Because bortezomib-containing regimens have been shown to give better results than VAD or Melphalan and prednisone therapies, the other options would not be appropriate for this patient. Thank you for listening to this week's episode of the ASCO University Weekly Podcast. For more information on the treatment of multiple myeloma and other plasma cell dyscrasias, including opportunities for self-evaluation, visit the Comprehensive e-Learning Center at university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.